Welcome to the wonderful world of wellness with Dr. Andy Mencia. This medical program heard from 7 to 7:30 each Saturday right here on WSBR 740 AM is brought to you by the Adult and Geriatric Center under the medical direction of geriatrician Dr. Andy Mencia.
Well, good morning, everybody. Good morning. It's a wonderful morning here in Florida. A little bit of rain that we need for the plants and everything. And this morning, Anita, we left her outside the studio. We locked the door on her. She's knocking on the door with both hands and both feet, but we will not open the door. We're going to let her go on vacation for a weekend. But I have the pleasure of having Ina with us here. My dear good friend Mike. How you doing today, Mike?
Great, Doc. Great.
Everything good?
Everything is great.
Everything is great. Excellent. And today I want to talk about your dental department. You know, I make sure in my practice that everything that we have is like staying ahead of the curve when it comes to new techniques out there. And I sent my entire staff to be trained for mini implants. How did that go?
It went great. As you said, all this time we've been doing traditional implants, as everyone knows. Now we're getting into something called mini implants, primarily for denture users. People with full dentures know what I'm talking about. Now there's a new system we just trained on that it's a little less invasive, more retentive. We can actually, people who have an upper or lower denture know what I'm talking about, how loose they can be, how much trouble they are. Now, with a matter of a few implants, it can be done in practically a day or a couple of days where there will be no more of that problem of dentures moving around.
Well, one of the things that I know from studying on implants and the medical aspect of dentistry is that the regular implant take about 3 to 4 months to heal or something like that, right?
Traditional implants are much bigger. The way it used to be done, once an implant is placed, whether it's the lower or the upper with some bone grafts, it takes about 4 months for that bone to integrate to the implant. Then the next stage can be started, which is the restorative part. So primarily, traditionally, it used to be about 6 months to 8 months, even longer, to do an implant. Now, these things can be done in practically in a day.
Excellent. And the healing part for the mini implant is very short.
It's less than half of what it used to be. It's practically
1 to 2 weeks, something like that.
1 to 2 weeks. It's a couple of sutures, nothing to worry about anymore.
Excellent. And with the regular implant, there's a lot of cutting. You have to expose the bone and make sure that the bone is flat and all of that. Right. What I was noticing from your course is that here, basically, you don't even have to cut on the tissue, if anything.
Very, very little.
Very minimum cutting.
Because the old implants used to be about 8 millimeters to 10 millimeters long. These are 2 to 3 millimeters long, so the space is much smaller that we need.
That's so interesting, because if you look, I know when I'm teaching the student about skin cancer, usually we look at the size of the lesion, and we say 10 millimeter. And usually when we are talking to the audience, we say it's like the 10 millimeter is like the size of an eraser in a pencil.
Right.
So 2 millimeter, that's really, really tiny. That's
very small, but very strong. The new material.
This is really non-surgical.
Oh,
this is
absolutely.
really non-surgical. Wow, this is very interesting.
Completely different than what we're used to.
Mm-hmm. And so, because I tell you, I see patients when they come to me, when I have my students with me, I tell them, you have to look at the patient when they are talking to you. They are articulating words. And if the dentures are fully fit very loosely, it's very embarrassing to the person.
Sure it is. As you know, every day in our center, me and you both see this. You send me patients, and people, they have them in their bag or in their pocket. A lot of your patients don't even wear them anymore.
They don't want to wear them.
They don't want to wear them. They look terrible. Of course, people's face change through years, lose weight, whatever, and these things need to be fixed, but they don't want to wear them. We see that a lot. This will take care of that. It's amazing.
We use so many muscles when we smile. We use so many muscles to smile. And having said that, when you have implants, when you have dentures that are loosely fit in your mouth, you're using all of those muscles. Are you aware you're using so many muscles in there trying to keep your denture in place so that they won't come off?
Exactly.
And then the psychological impact of you going out for dinner with a friend. And you are afraid that your denture is going to pop up if you start.
Right.
Especially if you go out with dinner with me, because it will make you laugh. So for a person that have dentures, if they come in for a consultation and they do the mini implant, they don't have to use the denture adhesive that they buy.
Right. Right. This eliminates the use of it. If you can picture it, I mean, each case is a little bit different, but just say on the lower arch, somewhere between 2 and 4 implants are made. Then we retrofit that denture to snap right in. Obviously, you don't need adhesive anymore. You don't have to taste that. You don't have to buy it. This you will take out in and out yourself, just like you normally would, but they snap into place.
So the denture
snaps right into place. You don't have to
asleep with them and take a little nap, and it's not like the other denture that if you're gonna take a nap, you better take them out because they can fall off.
Well, I've seen some other patients that come in also that with their speech you're talking about. They're using those muscles to hold those plates in place as they talk.
Exactly.
So now this is a new experience. It's just like having your teeth back.
And I see some of my patients, when I'm examining their mouth, I say, open your mouth. If they have denture in, sometimes they get cramps on the muscle. And you see they start tapping on, on
and you get used to it. They get used to know how to hold the denture. Yeah, it is. And we see it all the time.
Yeah.
Now, again, like we talked about, there was 3 things that we've learned why people don't do implants. Number 1 on the surveys is that the time it takes to do implants. The second thing is the cost. And the third thing is the surgery that's involved. Now with this mini implant system, those 3 things are really knocked down. The time involved is nowhere near what it used to be. The cost, now we can reduce the cost because the cost of the implant, right, the surgery is not as bad, so we cut down the cost a lot. As I said, each case is a little different, so we like to get you in for the consultation, which mainly we're looking at the bone level, your old denture, whether we need to make new dentures or use the old ones. So that's what this consultation is involved with. It's not long. It's maybe 15, 20 minutes, and then we can come up with the right case for you.
Yeah, just to be clear, when you do that consultation, if they need a Panorex, that is not included. The consultation is just looking at the patient, looking at the
special X-ray. If we need to do that on some people, we do have that equipment available.
I have everything you need in that department.
I know you do.
You ask for it, and I won't get you the alcohol or anything like that. But since you say that, so for the first 1,000 callers, we can say that they're going to get a free consultation.
Sure.
Let's give the phone number out, and they can call the office
at 954-489-1345.
Okay, so pencil talk. Let's put this down: 954-489-1345. They can call the office and ask for Mike from the dental department. He is my manager in the department. And he will not only sit down with you and help you go through the entire process from beginning to end, but he is the type of person that gets off the chair, he goes into the exam rooms, and he makes sure that he hooks you up with one of our dentists and that you are satisfied from beginning to end. So do ask for Mike. And so tell me, Mike, when the person come in for a consultation, it's not a long procedure, right?
No, maybe a couple of X-rays.
They need to bring their dentures.
Definitely need to bring the dentures. Definitely need to bring.
We have one patient that came in for consultation. Say, but I forgot my denture at home.
Exactly.
It doesn't work
they need
like
to bring that in just so we can see how it's fitting. And again, remember what we talked about, your patients especially. when we see those geriatric patients and their families bring them in that they've lost all this weight, and now this is going to be so beneficial to your patients now that they'll be able to eat better instead of having loose dentures in their mouth. This is what we're trying to get at in the dental department for your medical patients and ours. And that was our main complaint, is that my mom's not eating anymore, my dad doesn't eat anymore, and the dentures just lay in the drawer.
You know, that's an important point, because, you know, when we are teaching students about digestion and the alimentation, taking the food, digestion starts with your teeth. Exactly. If you cannot masticate, if you cannot bite the food, you are not going to absorb all the nutrients that Mother Earth had to give you.
Right. We see it every day.
We need to be able to chew the food properly, and then swallow the food, and then the whole process starts.
Right.
Excellent. So, Mike, tell me, because those, you know, I'm always concerned, you know, the denture adhesive people use. You know, I'm very against chemical stuff in my body.
Yes.
You know, I'm very pro natural thing. Those adhesives, these are chemical.
Yeah, I think
because some of my patients, they tell me I get nauseated.
I was just going to tell you that. I mean, my main complaint that I hear is that when they have to use that much of that adhesive, it does make them nauseous. The taste, the smell. If you have to use this, I mean, that stuff mixed with food, it's terrible smell. Yeah, and that's the main complaint. I don't think it's good for the body. I mean, they're swallowing this eventually all day long. And some of the people I see come in, you're supposed to use 3 drops of that stuff. I've seen half a tube on the denture, and it can't be good for you. You know?
It's like one of my patients say he went to visit his daughter, and when he got to where whatever his daughter lived, he forgot his adhesive, and he was so embarrassed.
Absolutely.
You know?
People call me every day asking if I have samples of that stuff. Yeah. You know, it's not good to have.
So this is an alternative now to a person that already have denture or is considering having denture. You can have, because, you know, there are patients that have their teeth all rotten, so their teeth are all rotten and everything, and they are afraid to take them out because they know they're going to end up with denture.
Right. And they don't need to go to the implants immediately. For people who still have teeth that we need to do the extractions, I think we talked about it once before about immediate dentures, where we can make a denture upper or lower or both, and the day they are ready, we take the teeth out and put the denture in that day. Then as they heal, maybe in a few months we can talk a little bit more about implants. But right now, for people who are completely edentulous and had all their teeth extracted, this is what they need right now. This is perfect for them right now. And the cost, again, is this economy, you'll be surprised really on the cost of it. Each case is a little different, but the cost on it is not what you think.
Yeah, exactly. Very interesting. And beside the implants in your department, you guys have the whitening. We can do the whitening for because sometimes, you know, a person, when we talk about implants and denture, there are patients out there that they only need the upper or the lower. So they don't need to have upper and lower.
No, we've done that before. Somebody has an upper denture and wanted to whiten the teeth. We do it all the time. We'll whiten the teeth to meet the denture need. It's done all the time. Yeah. But whitening is a great product. The Zoom is what we use. It's a great product.
Right. And that's important because, you know, I see patients sometimes, and, you know, I'm very much into aesthetics. Right. And then you see a patient, they get beautiful denture done for the upper, and they don't take care of the lower, and you can see that the one on top are denture because you see the difference. You know, one look brown and the other one look white.
Right.
So when you do the whitening, then they both gonna match.
And I don't think a lot of people don't realize when they had their denture made, there are different levels of teeth that can be made on it.
Different color.
Not just the color, the shade, but different quality of teeth can be made from a lab. There's premium teeth. There's a standard, there's a standard denture.
Different color.
Right. No, well, but the teeth look better. They're stronger. They last longer than the really acrylic teeth that is made with a standard denture. If you've seen some of your patients come in, they look all worn down. Those are just standard dentures.
That's why, it's so important. I get patients, they come to me and they say, I'm going to go, there's a special going on dental, and I'm going to go to this place and get my denture done, and it costs me 10% of what everybody else is charging me, but then you put those denture on and you bite too hard and they crack.
Right.
They will crack open. And I get a lot of patients coming in and they say, now I need to redo. So you get what you pay for.
And a lot of people just, again, with this economy is what the insurance pays. Of course, we all know about insurance companies, what they pay, what they don't pay. But just ask, because you'll be really surprised at cost if you don't ask about it. We don't put our big costs on patients. We cover our expenses, but you'd be very surprised how much this system costs you if you don't ask about it. Don't be afraid about it. Ask about it. It's a 15-minute consultation, and it could change your life.
Excellent.
It could certainly change your life.
Mm-hmm. So for the first 1,000 call.
Ask for Mike. See my secretary.
You can come in for a consultation, and I tell you, one of the things that I love about the practice, the way I have created this system, is that I love to have my dental department working on patient while I am on the premises, so that there is a medical hand-on individual right there for the patient.
You're a great help. You're a great help when it comes to medications and things. When I do a treatment, I need to know, of course, I check with you. When people have to come off certain medications for our surgeries, it's a great, great asset to have the way you have that set up.
And even when you guys call me, even if it's not my patient, somebody that just come from the outside for a consultation, and there are certain medications that you guys are not sure of, and you say, okay, let's consult with Dr. Mencia, and I just go up there free of charge.
That's just it. But to all my career, if you don't even know what it's like to try and get, say, another dentist or another doctor's clearance, you can call all day. Yes, I'll fax it to you. It could take days before I hear back from him. With you, it takes me 3 minutes to get a clearance, and we're working.
Right.
That's the beauty.
Of it. Yeah, because in the real world, when you call, you are not talking to the doctor.
Right.
Talking to the operator,
to a front desk,
right?
And I can never get a
that front desk is going to take the message and give it to a medical assistant. The medical assistant is going to go to the manager, that then is going to go to the doctor.
Right.
So by the time the message gets to the doctor, who knows what the message is now?
That's right.
So here is like straight hands-on.
No, we get right back to you right now.
So relatively, this is a very quick procedure, and it's mainly indicated for all of those individuals that have either upper and lower denture or one or the other one, and it's non-invasive or minimally invasive.
Right,
and the entire staff. I make sure, knowing that we have now dentists that can do the procedure, having the dentist to me is not enough. That's why I decided when we were going to take on this new procedure that just came out, I decided, let me take my whole staff, because a dentist cannot work by themselves, and I'm very, very pleased that all of you went through the training.
The more educated we are, the better, clinicians we can be.
Absolutely. And the better service we can provide. I don't want to see mistakes in my practice, on my watch.
No.
So I do whatever it takes and spend whatever money need to be spent to make sure that all of you are well trained. And in the center, not only we have the dental department, we also have a neurology department, pain management, podiatrist, the nutritionist, the psychologist, the hypnotherapist. We should do an implant using the hypnotherapist, see how that will work. See, the hypnotherapy can relax you.
No anesthesia.
No anesthesia. The dermatologist, I don't know if I forgot the dermatologist, and the ophthalmologist we have. So we have a full, it's a full service, and those of you that have come to the practice, you see how it works. For those of you that have not been there, basically it's an open system where we all communicate with each other. You don't go from suite 101 to suite 308. You stay in the same level, and all of the doctors communicate. We have a huge conference room that we can sit down and dialogue with the patient, always in the center of concern.
And I think the main thing is when you get a phone call, if somebody calls the office, you'll get a return call immediately. Or that day, put it that way. You're not waiting for a prescription or to talk to a doctor.
Absolutely. I had one of my patients that came all the way from West Palm Beach to see me, and he drove there to the office, and he has this horrible rash on his left leg. And he was very nice. He was teaching the student about his rash and how this has been going on, and I noticed that he had two rashes going on, two rashes at the, different diseases at the same time on the same leg. So immediately we got him to see a dermatologist. Same visit, and the dermatologist called me and we spoke on the case, and he concurred with me. These are two different situation, and in the past he was told that he has psoriasis, and the guy is very intelligent. He's one of my friend in flying. He's a experienced pilot, and so we started talking, and I say, it doesn't look like psoriasis to me. And he read a lot about psoriasis, and he said, I know psoriasis is supposed to be all over the body, can just be on one part of your body. And I say, you're absolutely right. You're absolutely right. Doesn't look like psoriasis to me. And the dermatologist that was seeing him before wanted to treat it as psoriasis, and somebody like a primary care physician had to take a stand if the treatment is not right. So I was very happy that we got a consultation yesterday, and got him to see the dermatologist immediately while he was seeing us, and that we got an answer the same day. Yeah, because try to get an appointment with a dermatologist. Try to get an appointment. A dental department like yours, it's so sophisticated. You have all kind of specialists doing all kind of different dental procedures. Sometimes when you call those specialists, take a long time to get an appointment outside the system that we have. In our system, everything works so smoothly. For the patient's sake, everything works much faster.
Right. I've said that in the past before here, that it's not a long wait. I mean, we're a busy office, but we see everyone in a timely fashion. If not the same day, the next day, but you're not waiting. No one waits.
I had one of my patients that came in a wheelchair with multiple sclerosis and was not taking any treatment. And of course, when I look at all the reports and what he has, and I say, you need to see a neurologist. He said, yeah, I made an appointment. I had to wait for 2 months to get in to see the person I want. I said, no, you're going to see a neurologist today. Right. And he was amazed. He was crying. Right. No. He was crying. He said, you're going to get me to see a neurologist today? I said, yes, you'll see a neurologist today.
Tell me that every day. Every day.
That's what it's all about. That's what patient care. So let me give the phone number. What's the phone number, Mike, for the office?
954-489-1345.
And Ina W. Buenos días.
¿Cómo estás?
So we are very happy to have both of you here, and we are happy that we bring all this information to our audience every Saturday morning from 7 to 7:30. Please, when you come by the office or when you write to us at the station or through the magazine Baby Boomers, give us your feedback on this particular Wonderful World of Wellness. Let me know what you think, what you want to hear, what kind of because I'm doing what I think is the most information for you to have, and I want to get feedback also from you, so we can always continue to make the program better. So tell me, we still have a few more minutes. Tell me about the setup when the person need to come in. If they start calling today, we know you have a live answering service that will pick up the call. How early can they get appointments set up just for a free consultation to come in?
They call today, I'll have them in Monday or Tuesday.
Okay, so it's very
Monday or Tuesday for the consultation.
Okay, excellent. I know I know a lot of your dentists now because we have them listening to the show. We have all the staff listening to the show, so they're going to be saying, "Oh my God, we're going to be working overtime now." So get ready. Put on your roller skates.
It's okay. We're here to help. You know that. This is all we live for.
Yes. And when you do come for the free consultation, if there is anything, if you have any problem, please, talk to Mike. And I will assure you that he will take care of the problem. If that doesn't happen, then talk to me. And the hours
are from 8 to 5.
8 until.
8 until. That's right.
And we are open on Saturday.
Yes, sir.
We are open on Saturday. Saturday schedule is great. We are seeing so many patients. They are so happy. They get to come with the family because sometimes the family is working, so they get to come together with the family. Right. So Saturday has really, really taken off, and we get to have Ina running the front with her beautiful green eyes. And her beautiful smile, running the front and running the back, and you see her running side to side. But she always walk around with her cup of coffee in her hand, like a true Russian. Хорошо? Good.
What's the address for the office?
1608 East Commercial Boulevard. We are open Monday through Saturday, full day. And usually we start, Mike and I were there by 7:30. I had a patient that came in at 7:30 in the morning. She really put us to the test.
Yeah.
She said, "Oh my God, you are really early over here."
Yesterday, the day before me, and you were there 7:15. They were pulling up.
They were pulling exactly
in your chair by 7:30.
So thank you very much. It has been a great show. Thank you, Mike. Thank you, Ina, for coming. And enjoy the rest of the day. It's a beautiful day. And for those of you with Friday the 13th, now today is Saturday the 14th, it's time to come and see your doctor. Yoo-hoo!
Yeah.
Thanks for listening to The Wonderful World of Wellness with Dr. Andy Mencia. Be sure to tune in each Saturday morning from 7 to 7:30 right here on WSBR 740 AM.